Congenital heart defect. Congenital heart defect arises during embryogenesis, usually week 3 to 8, seen in 1% of live births. The most common congenital heart defect is ventricular septal defect. In ventricular septal defect, there is defect occur in the septum that divide right and left ventricle. You can see here in the diagram, there is a defect in the right and left ventricle. Result in left to right shunting occur. Atrial septal defect. In atrial septal defect, there is defect in the septum that divide right and left atria. Most common type is ostium secundum. Result in left to right shunting occur. Patent ductus arteriosus. Patent ductus arteriosus is failure of ductus arteriosus to close, associated with congenital rovella. Result in left to right shunt between the aorta and pulmonary artery. Tetralogy of Fallot. Tetralogy of Fallot is characterized by narrowing of the pulmonary valve, thickening of wall of the right ventricle or right ventricular hypertrophy, displacement of aorta over the ventricular septal defect, ventricular septal defect opening between the left and right ventricle. Right to left shunt lead to early cyanosis. Degree of cyanosis determine the extent of shunting and cyanosis. In tetralogy of Fallot, boot-shaped heart is seen in X-ray. Transposition of the great arteries. Transposition of the great arteries is characterized by pulmonary artery arising from the left ventricle and aorta arising from the right ventricle. Associated with maternal diabetes. Present with early cyanosis, pulmonary and systemic circuit do not mix. Creation of shunt after birth is required for survival and for allowing blood to mix. Prostaglandin E can be administered to maintain a patent ductus arteriosus until a definitive surgery repair is performed. Truncus arteriosus. Truncus arteriosus is characterized by a single large vessel arising from both ventricles. Truncus fail to divide. Present with early cyanosis, deoxygenated blood from the right ventricle mixed with oxygenated blood from the left ventricle before pulmonary and aortic circulation separate. Tricuspid atresia. In tricuspid atresia, tricuspid valve orifice fail to develop. Result ventricle is hypoplastic. Often associated with atrial septal defect, result in right to left shunt present with early cyanosis. Coarctation of the aorta. Coarctation of the aorta is actually the nerving of aorta, classically divided into infantile type or pre-ductal coarctation and adult type or post-ductal coarctation. Infantile palm or pre-ductal coarctation is associated with the patent ductus arteriosus. Coarctation lies after distal to the aortic arch but before proximal to the patent ductus arteriosus. In adult form or post-ductal coarctation is not associated with patent ductus arteriosus. Coarctation lies after distal to the aortic arch.